Hi friends, and welcome to my clinical pattern video for Dupuytren's contracture, otherwise known as Dupuytren's disease. Dupuytren's contracture is characterized by a chronic fibroproliferative disease that affects the palmar fascia, causing collagen cords or nodules to form. These bands thicken and tighten over time, which leads to permanent flexion contractures in one or multiple digits, and it primarily affects the MCP or PIP joints. The most commonly affected digits are the fourth and fifth. The prevalence of Dupuytren's disease is 3 out of every 10,000 adults in the US, with the average age of onset being 50 years old, and it affects men more than women. Outcome tools that you may want to use include your basic goniometry or the DASH. The mechanism of injury is idiopathic. Typically, patients might feel a lot of itching, which can be uncomfortable, but pain is not common. However, pain can be aggravated with forceful extension of the contracted joints. Pain can be eased with heating or NSAIDs, and there's no 24-hour pattern. You may want to perform a review system to rule out diabetes because the symptoms could be being caused by diabetic hand stiffness. Precautions include avoiding passive extension past P1 or R1 in the presence of a contracture. And contraindications include avoiding prolonged or repeated flexion in the contracted joints. During your physical exam, you're likely to observe different things depending on the stage of the contracture. So there's 3 different grades of Dupuytren's disease. Grade 1 includes the presence of a nodule or thickened band in the palmar aponeurosis, and you're likely to observe skin pitting, tightening, or dimpling. I'd really recommend going and looking at my written pattern and seeing the pictures so that you can get a better idea of what this looks like. Grade 2 Dupuytren's contracture includes the presence of a tight band and limited extension of the affected finger, and grade 3 includes an established flexion contracture. During your active and passive range of motion assessments, you'll likely see MCP and PIP limited extension, and it may possibly be painful with extension. In your resisted testing, you're likely to find weak and painless MCP and PIP flexion. When you palpate the area, you're likely to feel that nodule or rope-like growth in the palm, and you'll also find decreased mobility of the palmar skin and fascia. One special test that you can do is called the tabletop test, in which you ask the patient to rest their hand on a flat surface, such as a tabletop, and due to the contracture, their palm won't be able to rest flat on the surface. So just to show you what that looks like, if they had a contracture in their 4th digit, which is the most common, they wouldn't be able to rest their palm flat on the table. Your differential diagnoses that you want to rule out include ganglion cyst, stenosing flexor tendinosynovitis, and as I mentioned before, diabetic hand stiffness. Diagnostic imaging for Dupuytren's contracture includes x-rays, ultrasounds, and again, lab work to rule out diabetes. Signs and symptoms indicating referral to a physician include flexion of the MCP joint greater than 30 degrees. That's a flexion contracture greater than 30 degrees. And any flexion contracture of the PIP joint. Their physician will likely perform surgery when the MCP contracture exceeds 40 degrees or if the PIP contracture exceeds 20 degrees, or if function is impaired and other approaches have failed. There are a few different options for surgery. All have different rates of recurrence. Unfortunately, the rates of recurrence are fairly high. The least invasive procedure, and the one that's performed most commonly, is a needle fasciotomy, and that has a 75% recurrence rate at 5 years. Other options include a limited fasciotomy, a dermofasciotomy, and even potentially amputation or arthrodesis if the other options have failed and it's preventing their function. There's 3 likely scenarios in which you'll see this patient. 1, they're coming in post-op. 2, they're coming in to manage or slow the progression of their Dupuytren's contracture, or 3, they're seeing you for an unrelated issue and they have either diagnosed or undiagnosed Dupuytren's contracture. So be sure to know the signs and symptoms and when to refer to a physician when necessary.